Learning outcomes. At the end of this lesson, students will be able to determine counseling skills, know what are the processes of an attending behavior during counseling, understand how and what means to be used when using observational skill during counseling, know how paraphrasing is done during counseling, and recognize the significance of counseling skills. Background of the main topic. Professional counseling, according to the American Counseling Association, is the process of developing relationships with individuals that lead to improving mental health and wellness, education, and career goals. There are a variety of issues that lead people to counseling. With the guidance of a qualified and experienced counselor, any difficulty that comes between any person's life goals, priorities, and commitments can be addressed. In order to develop a solid relationship between the client and the counselor, effective counseling skills are essential. Therefore, it is important for counselors to have basic counseling skills to help them better understand and listen to their clients. Attending, observing, and paraphrasing are just a few of the counseling skills and techniques that may be learned and used to help establish and maintain the psychological process of counseling.
Attending behavior. Attending refers to the ability to be physically there for the client. It is a powerful tool capable of contributing to the client's self-respect and security while also acting as a reinforcer and facilitator of communication. It entails giving them your undivided attention, being attentive to the subject with the clients, not jumping from one subject to another, making appropriate eye contact, being physically relaxed, mirroring body language, and nodding. These attending behaviors demonstrate that you care about your client. It requires actively becoming aware of what the other person is saying as well as what they are attempting to communicate to us. And attending has the effect of encouraging the person to continue freely discussing his or her thoughts or feelings. Attending behaviors are the verbal and nonverbal behaviors that indicate that the listener is paying attention to and engaged in the speaker's message. For examples, refer to the speaker by name, using encouraging statements, posture toward the speaker, maintain appropriate eye contact, show interest and concern in your facial expressions, nod head to convey affirmation, and also avoid distractions.
The 5 sub-skills of attending in counseling. To provide good counseling, the counselor must have the following basic communication skills that would enable them to demonstrate how they may be physically and psychologically with their clients. First is listening, summarizing, basic empathy, integrating, communication skills, and proving or questioning. And the key elements in attending. First is eye contact. Directly looking at someone shows that you are paying attention to them and that you are listening attentively to what they have to say. It's best not to stare too long at someone because it can make them feel uneasy. Simply be yourself and natural in your approach. And keep in mind that eye contact is considered impolite in someone's cultures. Body language. You keep your posture in mind. It's a great approach to get someone to talk about themselves if you're relaxed. Leaning forward in your chair shows that you're paying attention and actively listening to what your client has to say. Gestures. Your body language tells a lot. Sitting with your arms and legs crossed and hunched up, for example, can give the appearance that you've put up a barrier and aren't paying attention. It's also incredibly distracting to wave your arms around. The facial expression. Face expressions are important to a good listener. Frowning or raising eyebrows can convey disgust or judgment, which can make a client shut down, whereas smiling at The appropriate times conveys human warmth with helps to build trust and develops connection. How you speak. Attending does not always entail just listening. You may need to offer clarifying questions or paraphrase what the client has stated. When responding, choose words that are thoughtful and precise. Make every effort to avoid any misunderstandings or confusion.
Observation skills. The ability to observe is a skill that is used throughout the counseling interview. Observing is a nonverbal communication skill in which a counselor observes a client's body language, tone of speech, and facial expressions. A counselor can assess the impact of his/her words and actions on a client by accurately analyzing nonverbal behavior. We don't always see as much as we think, and we need to get in the behavior of looking for information. We may miss nonverbal behavior or other indications that reveal the significance of what is going on unless we are paying close attention. When you observe your own behavior and that of your clients, you can anticipate individual and cultural differences in nonverbal and verbal behavior. Counselor must pay attention to patterns of client behavior, nonverbal verbal behavior, conflict, inconsistencies, and discrepancies, as well as individual and multicultural issues in nonverbal behavior.
7. Method of observation. Testing method. Use tests to learn about human behavior. Case study method. In-depth investigations of a person's or small group. Cross-sectional method. Observe participants over a long period of time. Naturalistic. Observing subjects in their natural environment. Laboratory method. Observing behavior in a lab. Longitudinal method. Participants are observed over a period of time. Participants method, a process of entering a group of people with a shared identity to gain an understanding of their community. When to use clients' observations in the counseling interview. The counselors, or called also, identify discrepancies or inconsistencies the clients of their own communications through skilled client observations. When a client arrives into a counselor's office, for example, the manner the clients walk in, take their seats, and greets their counselors to provide the counselors some indications into how the client is feeling about decisions. Are they reluctant, comfortable, or awkward? If the client is receptive of the counseling sessions, they may lower their gaze, appear dismissive, or the counselor and sit in a closed positions which inhibits communications. A counselor may also assist the efficiency of their remarks by paying close attention to the clients, facial expressions, and eye contact. When the counselors ask a questions and the client is defined embarrassing to answer, the clients may lower his or her eyes, look away, or lower their head. This will alert the counselors the possibility that the client is uncomfortable with a statement or inquiry.
The purpose of observation skills. Counseling aids in the cleansing of an individual's mind of unwanted thoughts and behaviors that, if not addressed, can leave the mind dull, anxious, and confused. The capacity of a counselor to critically observe a client would help in lowering the risk of ill fate. When a counselor observes a patient closely, the counselor gains a comprehensive understanding of the issues the patient or client is dealing with. As a result, even after the patient or client has been discharged from the counseling facility, it is necessary to keep a follow-up. Close observation of a client would help in the diagnosis and analysis of problems that influence the individual. Observation is important because it allows the counselor to have an one-on-one interaction with the client and, in most cases, allows the client to open up.
It facilitates communications counselors would have a better chance with the clients, since it would help them communicate more effectively with others. This is because they would be capable of assessing other people's opinions about specific topics and changing their minds as a result. It also enables you to understand your rivals and friends better. In addition, it aids the counselor in identifying material concerns in the individual's life. Observation can help enhance decision-making abilities. Counselors gain a better grasp of their clients or members of staff when they have the opportunity to examine them closely. This would this would provide a greater chance of knowing how to deal with or counsel the person involved.
One of the counseling skills that are quite important in the counseling process is the paraphrasing. It is the skill of the counselor to repeat what the client has said in the present moment with fewer words and without altering the meaning of what the client intended to convey through his words. Focus on the keywords and significant points that the customer has communicated and relay them to your patient in a reduced and rephrased version. This not only shows your client that you've heard what they're saying, but also that you're striving to get a better understanding of them. Why do counselors use paraphrasing? In the counseling process, paraphrasing is one of the most crucial abilities to have. In counseling, paraphrasing is a technique of responding that shows the client that the counselor has accurately heard what they have said. These kinds of paraphrases, encouragers, and summarize are crucial for the client to feel understood during the counseling process. They make the client feel more at ease and less vulnerable in their therapy interaction. Paraphrasing and summarizing are active and effective ways of letting the customer know that they were heard. How is paraphrasing helpful? Paraphrasing is important for the both client and the therapist's shared knowledge of the client's condition. In many cases, it assists the client in revealing the source of his thoughts and emotion, and it serves as a turning point in the counseling process for the client. The therapist also uses the paraphrasing skill to clarify and reaffirm the meaning and tone of the emotion used to express anything said by the client, to clear the air of any uncertainties or confusions, and to make the counseling process easy and painless. It facilitates communication between the client and the therapist.
How do you paraphrase? Start by listening. Listening is always the first stage, whether the goal is to paraphrase or reflect. Counselors have a deeper understanding of what their clients have gone through in a certain situation by actively listening, looking beyond the surface, and attempting to connect with the client on an emotional level is what active listening entails. Counselors use both their ears and their hearts to achieve this level of emotional depth. This entails putting yourself in their client's shoes and focusing on the emotional side of the experience. Next is focus on feelings and thoughts rather than circumstances when we listen to others' person. The most evident component are relative to the real experiences that he or she has gone through. Details like names, dates, location, and other circumstantial difficulties, on the other hand, are less important than how a person viewed and felt in a given situation. When it comes to paraphrasing, counselors are taught to look beyond the circumstances to figure out why a client has chosen to discuss a specific event. A series of emotional experiences are virtually always the cause. Next is capture the essence of the message. Despite the fact that humans can feel a wide range of emotions in a given scenario or environment, there is always an underlying emotion that determines how they respond. The golden nugget that counselors are attempting to capture and portray through paraphrasing is the underlying emotional mood. When paraphrasing is done correctly in the therapy, it establishes an emotional bridge that lays the groundwork for genuine and meaningful connections. Clients will be more willing to open up and disclose their problem as a result of this. Next is offer a brief version of what has been said. The next step is to provide a concise description that emphasizes the story's emotional tone when the message reaches the client. Foster a sense of comprehension, which in turn fosters trust and genuine connection. Paraphrasing is a useful method for building empathy and facilitating therapeutic transformation.
So now let's proceed to the four tools to help you paraphrase. Listen carefully and remember what the client said to ensure that you remembered everything and didn't forget anything important. First is identify the content of the information provided by the client by evaluating what event, circumstances, idea, or a person the client is discussing. Remember that content relates to what is actually being communicated through words, expression, and pattern as well as what is committed. Second is rephrase the totality of what they've said in as few words as possible. Use the patient's keyword and primary ideas to rephrase what they have said in a new day. Next is the rephrase the totality of what they've said in a few words as possible. Use the patient's keywords and primary ideas to rephrase what they've said in a new way. Third is check your perceptions. This allows the client to confirm or contradict your paraphrase accuracy. You never want to put words in their mouth, so making a perception check in the form of a question is a good way to go. And the last one is consider the feeling of the patient. In a respectful, open-ended approach, you want to go over what the client has directly stated through words and nonverbal behaviors. You should also draw some conclusion regarding your client's emotional state. It is critical for you, the counselor, to pick your words carefully while communicating with your clients. That is why it is important to utilize words that are identical or similar to those used by your client.
The main goal of paraphrasing is to provide feedback on the essence of what someone has just said. The following scenarios benefit from paraphrasing. The first one, when you need to clear up and clarify doubts about the client's unclear content. The second one, when you want to draw attention to issues that need some additional explanations and precisions. Third, when you want to assess the accuracy of your perceptions as a counselor. Emphasis on essence. When a counselor uses paraphrasing, the goal must be disclose the core of the client's words. After hearing you out, the client should have a clarity in terms of paraphrases you use to communicate with them, and they should not be puzzled or at a loss for words. They must be able to carry on with their conversations without being scared or surprised by your own choice of words. Growth of empathy is more than just a counselor's ability to put themselves in the shoe of the client and comprehend their problems. It is also entails the client accepting the counselor's emphatic energy, which is communicated through his or her words and actions. A form of acknowledgement. The counselor provides a type of acknowledgement called paraphrasing. This is accomplished by consciously repeating the client's words, expressing empathy, acceptance, and genuineness. The role of the therapist does not include reading clients' minds or assuming their emotional states. As a result, it's critical to master the ability to quickly rephrase the client's remarks and acknowledge them honestly. Tone of voice. While paraphrasing the client's words, it is a good idea to keep an eye on the tone of voice used with the client. Take note of the following. First, a voice that is high or low. Second, a voice that is loud or soft. Third, a voice that is fast and sluggish. Fourth, whether you're accommodating or demanding. Fifth, a cheerful or dismal tone of voice. Be conscious of how you employ moderations in your voice, pitch, tones, and body language. The client has a great idea of faith in the therapist, and at the end of the procedure, they tend to remember how the therapist made them feel. As a result, it's critical to be cautious and sensitive while dealing with clients of the data they offer. At the end of the day, the counselor's goal should be assist the client feel validated and confident by using paraphrases. Alternatives that don't define counseling. There are two. The first one, paraphrasing is not the same as repeating the client's words. This is referred to as repetition, but paraphrasing entails emphatic listening and selecting the appropriate phrases to make the client safe and heard. 2. Parroting the client's words suggests that the therapist is not there mentally with the client, which may irritate and frustrate the client. As a result, they can eventually cease to communicate.
Good morning, ako guys sa ginang usa ka counselor ko. Ikaw si so akong pangitusulan karon ang imong problema o ang magimong solusyon. Kung ikaw makalaong ang inyong atong pagsusutan, dili lamang.
So, akong problema sir, gusto ko ka working student kanang hindi sa po sir, saan ako mag-manage ako ang oras kay kanang nag-working ako sa kong auntie, pero akong auntie may nag-offer sa ako ang ka-working ko kay kailangan ko dati nila nga na mag-working sa ilaha. Ko alam ko sir kay the online class ko at the same time, pero anong gawin nga mag-online class ko, makita niya nga mag-cellphone ko, masuko siya. Kaya nga daw ko namang sigil ako og cellphone, bisag wala pa ko nahuman sa kong trabaho. Pero nahuman ako sa kong trabaho na lang, yun siya gusto niya nga ipahuman nga trabaho niya na sir.
So, isa ka working student ug nagkuan sa online classes. Ug imong ante na offer sa imong nga ipa-working sa ilaha. Unya karon dili siya makasabot sa imong sitwasyon. Isip usa ka estudyante nga nagkuan sa online class.
Oo sir, kanang masuko siya sir, dawi nga nakita niya nga mag-cellphone ko niya. Gusto kanang nato ko kanang wala pa ko naman sa kong trabaho niya. Iyan ako dahil kung subuon sa lahi nga trabaho niya. Kung mayroon ko sa iya nga kanang mag-auntie mag-online class ako kadali. Ngayon siya nga maglamo-lamura daw kuno ko nga gusto na ko sir nga kanang apel ko sa mga klase namo kanang may klase pag morning pero masuko siya lagi pag mag-cellphone ko niya. Dili ko kaapas sa ako ang mga activity kay daghan ko siya gisugo sa ako niya. Gusto ko unta na ako galing nga hawa na lang ko sa ilaha pero nakabalanga po ko sir kay kanang kuan kanang sa kuang family food gusto ko kaayo sa akong family kay isa na iya kanang daghan kay may igsuon niya kanang ako ang mama o papa kay nagtrabaho lang sa kanang kuan mga adlawan lang at trabaho dili nila masustain mo ang mga pang-adlaw-adlaw nga kailangan mo nga galibog ko sa akong buhaton sa akong auntie saon ako siya pagpasabot kay kuan kanang running class bag ko dili na ako mamanage sa akong oras.
So usa ka rason nga nung sugod ka sa offer sa mga mag working student tungod sa kalisin sa inyong sila kayo maka-afford sa imong pangangailangan o gusto pud kay kamo eskwela. So sa imong pagkuan sa imong auntie nga dili siya makasabot sa imong kahimtang or sa pag-online class nimo.
Oo sir, kanang ambot lang kung nakasabot ba siya or kanang gusto lang siguro na nga patrabahoon ko per may bisig kuan. Okay naman unta kung gabi lang kay kung gabi pwede naman ako magbilar sa ko ang mga activity pero pag morning mangud sir ginana gid may mga klase good mga kuan mga synchronous class pero dili ko ka-apply kay kuan kanang ako lagi auntie lagi murag nasuko siya pag daway nga makita ko niya nga mag-cellphone ko tapos usay ko makita ko niya nga mag-cellphone ko suguon ko niya diretso ipabuhat ko niya sa mga trabaho nga bisag gumanan ako nabuhat inana ko daw siya.
So sa imong kaso sabton mo imong auntie nga sa imong sitwasyon nga ikaw sa estudyante o mangayo ka o gamay na oras para sa imong pag-eskwela o kanang sabot mo pag-ayo sa imong auntie nga nagkinahanglan ka nga mo attend sa mga activities para pud nga ma-maintain mo ang imong grado o
oo sir ganun gusto na ko siya istoryahon po na inaani lagi kailangan ako panahon para po sa ako ang pag-online class pero maulo po ko sir kay lagi naging time nga mag-cellphone palang galing ko makita ko niya nga mag-cellphone ko sa sala masuko na siya kay ano lagi daw nag-cellphone na ko nga napalagi na ko ipang buhaton ni nana pero wala na ko kinakita sir nga kanang manamag ko sa akong mga trabahoon pero wala si ko kabalo sa iya ang gusto nga buhaton nako na maulo sad ko sir open up sa iya sa akong online class kay maulo po kung panahid sa iya galing nga na muanha na akong eskwelahan kay gusto na ako og kuan kanang naay kami mga meeting sa mga kagrupo sa amo ang classmate dili ko maadlo kog ingon sa mga murag nakaapektuhan gid ako ang pag-eskwela tapos isa pa sa sir scholar ko sir kay nagimay na lang pod kay para makatabang sa ko ang kanang paghangulan sa akong pag-eskwela pero murag libog na ko sir wala na ako kabalon sa akong buhaton kay kanang tudag sa akong auntie na nawo kabalo asa ko padulong.
So i-suggest ako sa imo nga i-try nga i-open up sa imong auntie siguro makasabot na siguro ang imong auntie sa imong klintang kay isa man ka-estudyante o i-try good o istorya sa iya nga makasabot siya kay para mabahin ang imong pag-eskwela nga matadaan nimo o prioridad ang imong pag-eskwela kay daghan kay ka mga activities ng paghimuon o pasabton pud imong auntie nga wala ka nagkulang pagtrabaho sa iyang ipabuhat sa iyang panimalay.
To sum it up, attending behavior demonstrates that you care about your clients through being physically there for them, giving them your undivided attention, making appropriate eye contact, mirroring body language, and nodding to encourage them to freely express how they feel. As such, attending consists of 5 subskills that are used to provide good counseling, such as listening, basic empathy, probing or asking questions, summarizing, and integrating communication skills that would enable them to demonstrate how they may be physically and psychologically with their clients. Observation skill is used by counselor using nonverbal communication through observing the client's body language, tone of speech, and facial expressions through paying close attention. This skill consists of 7 observational methods, namely testing, case study, cross-sectional, naturalistic, laboratory, longitudinal, and participant method of observation. One of the counseling skills that are quite important in the therapy process is paraphrasing. It is the ability of the counselor to repeat what the client has said in the present moment with fewer words without affecting the meaning of what the client intended to convey through his words. When paraphrase is done correctly and without causing any confusion, it allows the client to recognize the therapist's effort and the level of empathy he or she has for their situation. As a result, paraphrasing aids in the development of a sympathetic relationship between the client and the therapist, which is vital because empathy is a two-way street.